So let's talk about a drug that is, and this is no exaggeration, both a lifesaver and a potential liability in the operating room. It's called Etomidate, and it's an anesthetic with one huge advantage and a really dangerous secret.
I want you to imagine you're a doctor in the ER. A patient is rolled in from a really bad accident, their blood pressure is in the basement, and they have to get to surgery, like right now. This is a huge problem because the very thing you need to do, put them under, could be the thing that kills them. And here's why that is. Most of the drugs we use for general anesthesia, the common ones like propofol, they all have a pretty predictable side effect. They tend to lower your blood pressure. Now, for a healthy person, that's no big deal. It's a small, easy-to-manage dip. But for someone who's already in shock, that little dip can turn into an absolute nosedive. So for a long time, doctors were looking for a hero. They needed an anesthetic that could knock a patient out without messing with their already fragile cardiovascular system. And that hero was Etomidate. I mean, just look at the difference here. It's pretty remarkable. While other drugs cause all this fluctuation, Etomidate just holds the line. Blood pressure, heart rate, how much blood the heart is pumping, it all stays incredibly stable. This is its claim to fame.
In medicine, we call this unique property hemodynamic stability. And really, you can just think of it as the drug's superpower. Right when a patient's body is in total crisis, Etomidate lets us induce sleep without adding any more stress to the system. It keeps things rock steady.
And it works with amazing precision. Give the injection, and within about a minute, the patient is out. But the anesthetic effect itself is super short. We're talking just 3 to 5 minutes. And what's interesting is that's not because the body breaks it down fast. It's because the drug literally just leaves the brain and spreads out into other body tissues like fat and muscle. So its job in the brain is done.
So this sounds like the perfect drug for our sickest patients, right? It's fast, it's stable, it's precise. Well, this is where the story takes a sharp turn, because our hero has a very serious hidden weakness. And to understand this weakness, we got to talk about cortisol. You've probably heard of it. It's the body's main stress hormone. When you're facing a huge threat, like a major injury or a really bad infection, your body pumps out cortisol to keep your blood pressure up, fight inflammation, and get energy where it needs to go. It is absolutely critical for survival. And here is the flaw, the bombshell. Etomidate directly attacks and shuts down the very enzyme your body needs to make cortisol. It finds the body's most important alarm system and just flips the off switch. This is what makes it so dangerous. Okay, remember how the drug's anesthetic effect only lasts for, 3 to 5 minutes? Well, the damage it does to the stress response system lasts way, way longer. A single dose can leave a critically ill patient unable to make the cortisol they desperately need for anywhere from 4 to more than 8 hours. And just look at the scale of this. A patient who should be mounting a full force, 100% stress response is suddenly left with maybe 15% of that power. They are, in effect, flying blind through the most dangerous part of their illness without their own natural defense system online. So this leaves doctors with an incredibly tough choice. It's a high-stakes gamble. Do you risk the patient's blood pressure crashing right here, right now, or do you risk their ability to handle the stress of their illness over the next several hours? So when is that risk worth it? Well, it's usually in the most extreme life-or-death situations. We're talking about trauma victims just wheeled into the ER, patients who are in shock because they've lost so much blood, or someone with such bad heart disease that any drop in blood pressure could be the end. In those moments, the only thing that matters is surviving the next 5 minutes. So where does that leave us? What's the final verdict on this drug? Well, it's not simply good or bad. It's a tool with 2 very, very sharp edges. And the source material we're looking at really just hits the nail on the head with this quote. It's a double-edged sword. I honestly can't think of a better way to describe the conflict at the heart of using this drug. It really boils down to this. On one edge of the sword, you have immediate life-saving stability. You stop the patient from crashing right there on the table. But on the other edge, you have this delayed, invisible danger. You're knocking out their stress response, which might actually make it harder for them to survive their illness in the hours and days to come. And that's the question that anesthesiologists and ER docs have to answer, often in a matter of seconds. Do you solve the immediate, certain problem of a blood pressure collapse, or do you avoid the potential, delayed problem of a weakened stress response? There's no easy answer. And that choice is what defines Etomate's very complicated place in modern medicine.